Button too soon, y'all. Let me get my settings together. I guess this is time for me to make sure that everything is lined up. One second, y'all. Let's see. I'm trying to make sure, because I got my laptop with me, just like I did last week. Trying to make sure that everything is set up right before I go into it. Let's see. My husband called me right before I went live, and I ended up hitting a button by mistake to go live right away. So my bad. But let me see. It looks like I am. Okay, so let's make sure y'all can hear me. Yep, you can. Okay, so I just hit 90K subscribers this morning, so I appreciate you guys. Um, a lot of you came from, the probably actually right now. I want to talk to y'all in depth about this travel nurse that's in an LTC. So if you don't know what a LTC is, it's a long-term care facility. So there are SNFs. If you're a case manager, you know that abbreviation, or if you in healthcare, inpatient, you kind of know what a SNF is. But a senior nursing living facility, that's a SNF. There are patients in there that maybe just need rehab, so they're in and out within a time frame of a couple of weeks, a couple of months. With long-term care is when you live there. Okay, it ain't no going back home. Your quality of life has diminished a little bit. Too bad for you to live at home by yourself. Maybe you don't have any family members that you can live with, or maybe everybody is gone and it's just you. So when we talk about long-term care, and while I'm talking, y'all can say hello in the chats, in the comments, say who you are. Just like last week, if you were on with me on Memorial Day, you can say who you are, where you from. So I'll start. I'm Sheena from Michigan. So when it comes to the long-term care, like I said, you're living there. So for this travel nurse, by the way, I found her video on TikTok, and I had to do a reaction to it because sometimes this really happens. I'm not saying that it happens for everybody. I've never worked in a long-term care facility. I've sent patients to long-term care when I did case management, but there's no way that, and I need some more likes, guys. There's no way that it is doable on a constant basis to have 140 patients split. So if you remember that video, she said it's 140 patients, it's two nurses, and one nurse refused to do meds on a whole nother, I don't know if it was a hallway or if it was I don't know, but she refused to do meds on some other patients because she had a really heavy amount of patients to do. Again, long-term care, they could be on vents, they could be on, multiple things. And that takes away from the time that you can medicate multiple patients at one time. So she said, look, I'm not doing it. I'm not medicating 70 people. You do it. So it's not 70 patients per nurse. The nurse that did the quick TikTok that everybody is like, oh, you got time to do a TikTok? I'm going to talk about that in a minute too. She did more than 70, because if the other nurse refused to do medication pass, somebody has to do it, and the CNA is not going to do it. And I don't remember if they had any CNAs after the one CNA got sick. She came in and got sick. Now, let's talk about people coming into work sick. It happens all the time, whether you're in healthcare, whether you're in retail, customer service, real estate. It happens because, well, I know for a fact it happens because people don't want to miss out on money, or sometimes the employers will say, well, no, you don't have any more call offs. Some people have so many call offs and then they get rolled up. So in their mind, because I haven't done this, if I'm sick, I'm calling off. Hi, SRS. Hopefully I did that right. Let me know where you from. But anyway, so, I just went off track. Okay, so when you are calling off because you're sick, some jobs say you only have 5 call-offs for the year, 8 call-offs for the year, however they do it, right? So the person that called off, instead of calling off, maybe she was out of call-offs, she came in and she was sick on the job. So that was proof that she was sick. I wouldn't necessarily do that, but people do it all the time because now that's not a call-off. They sent her home. She went home early. Now, when it comes to going home early, in some cases, this is a long-term care facility. I don't know their policy. In hospitals, when you go home early, it can be an occurrence. It could be a half occurrence, a full occurrence. You still get a ding against you. I don't know if this is the same case when you're sick. I don't know what shift this was, if it was day shift, if it was night shift. But people do come to work sick. I had a coworker recently. She got sick. She went out of town on a wedding, for a close friend's wedding. She told me that she had some type of poisoning and she had a fever and she had rashes and stuff like that. Now, she didn't tell me this stuff because as a nurse, she's a nurse. It's our duty to say, hey, you need to go home because I don't want whatever this is, you contagious. I don't want it. I don't want it coming back to me and my household with my family, my kids. Okay. So, hey, Emily, thank you. It's actually a jumpsuit. It's a whole jumpsuit, but thank you. So with her, I found out when she was leaving. Okay. Leaving. We worked the whole shift. I found out that she had a fever. Now, when she came in the next morning, she gonna lie about it. I said, oh, so-and-so told me that you had a fever. Are you okay? I really wanted to show my concern to see if she was gonna slip up. And not to say that I'm not concerned about anybody coming in sick, especially when we share the same area. I said, are you okay? She's like, oh, well, that's what happened last week. So that's when I had my fever. Lies you tell, because if she told one of the people that I work with, maybe the nurse assistant or whatever, I'm not going to put her title out there, PCT, one of the aides. If she tells her that she has a fever and she's in that day and she said, oh, I don't have any time, what do that mean? That means you coming into work sick and you're not trying to, sorry, that's my child in the kitchen. You're not trying to go home because you don't have any more time off. You don't have any sick time. You don't have any PTO. So now if you're infectious, you're infecting everybody that you're around, which is selfish, instead of just going home. Let me see. I donate $5 in your mailbox. Okay. Do you have an opinion on how there's a doctor/nurse shortage, but schools continue to be expensive and not enough programs? Greatness is rare. I'm gonna get to that. So to go back to that travel nurse, the travel nurse that was working and had 40 plus, because remember the other lady didn't even do all of hers, 40 plus patients to pass meds on, to check in, which you can't really even do good patient care with that many patients. The ratios are horrible right there. Um, she, since she's a travel nurse, she already has a mind, because I know travel nursing, I've done it for 3 years. She already has the mindset of, I'm going to go in this facility, it's going to be chaos. Let me see what I can do to make things better. That's my mindset when I go into it. Not everybody's mindset is like that, but travel assignments are not easy tasks. So she knows she was going to be in some trash. Number two, I've had a lot of comments of, oh, well, she had enough time to do a TikTok. Get a girl some slack, because some people debrief by recording a video. Some people wait until they're off to call somebody, maybe their mentor, a family member. That's what I probably would do. I would wait until I get off to to breathe, because you've completed the task. What she decided to do was get on TikTok and say X, Y, and Z. The good thing about it is she didn't disclose the facility. I don't know if it was the beginning, the end, the middle of her shift, but pretty much we know that short-staffed things were happening. If y'all don't know, this nurse worked in a facility as a travel nurse. Of course, they're short-staffed. Travel nurses go into places that are short-staffed. They're not going to grab a travel nurse that has been working in a fully staffed facility. That's not going to happen. They pay travel nurses more money to come in quick with minimal orientation and hit the ground running to take care of whoever you need to take care of. That is the purpose of travel nursing. Some person said, oh, well, she's making $100 anyway. Pause. This is not the height of the pandemic. There are no long-term care facilities that's paying travel nurses $100 an hour, unfortunately. Long-term care facilities and skilled nursing facilities are the lowest contracts for travel nurses. So no, she's not making that. Actually, with skilled nursing facilities and long-term care, they do pay their nurses more. Staff makes more money. So compared to a hospital setting and long-term care, you get more hourly wage for long-term, because you got to deal with more trash and you have minimal specialty teams to help you. But she's not making $100 an hour. Now, if she was in California, or maybe she's working for overtime, maybe she's getting $100 an hour if this was overtime. But just regular hours worked? No. So, that ain't happening. Let me see. So, greatness is rare. I'm gonna get to your question. Do you have an opinion on how there's a nursing doctor shortage, but schools continue to be expensive and not enough programs? So, hi, So Real TV. My opinion on the schools and doctor shortage. The nurse and doctor shortage. Okay, so I can only talk about nursing shortage because I am a nurse. But I believe the reason why there's a nurse shortage is because, okay, the pandemic happened. A lot of people died. A lot. And a lot of people are afraid to go back into the hospital. A lot of people retired, including my primary care doctor that I loved so much. She retired. She said, oh, I'm done. I did my part. I'm done. A lot of people didn't want to go back in that scene because COVID was around for a couple of years. Maybe, I would say 2.5. It's still around right now, but it's not as where you catch COVID and you're on a ventilator and you fighting for your life. Hey, Mimi. Make sure y'all giving me some thumbs up. I appreciate those. Those are free. But for doctors, where I work at, I see a lot of residents. Now, in order to get through with residency, you have to work as a resident for what? 4 years, I believe, and then you get into your whatever your specialty is, and you can work. But when you're a resident, they're the lowest paid people. People say CNAs don't get nothing. No, residents get like bare minimum. And, this is just paid help and they getting nothing. Because they're still learning, and the ones that I don't care for is the ones that think they know everything, and then a nurse that has been around that has a little bit more knowledge in that area humbles them. Hello. But they have to remember we're a team. We have to work together. So you got to get all of that arrogance out the way because you're not a doctor yet. You still in training. Okay. What? Mr. Mahmood, what you mean, where's your color? What that mean? What you trying to say? What's my color? What is my ethnicity? What color is my jumpsuit? Give me more specifics. All right. Emily H. It created a traumatic workplace, even more so than a normal hospital. Yes, it did. I agree because when the pandemic happened, what did they tell us? How many weeks did they say? How many weeks did they say? It was 2 weeks, right? Remember, it was 2 weeks that we would quarantine and then we would go back to work. Absolute lies. That 2 weeks turned into a year, 2 years, and then it's like everybody, I'm even trying to get back into the flow of, being around and going to events where it's multiple people. I keep my distance. If anybody sneeze, cough, blow their nose, I'm like, oh yeah, hey, from a distance. But no, I can't. I can't. And I still do functional things, but I'm not outside like I used to. I'm not. Maybe it'll take some time. I really need a vacation because I haven't taken a cruise like I usually do with my husband since 2019. So it's time to get back into the groove of things so that I could just get away from the job, from the house. Okay. Let me see. I'm missing some stuff. Is it Vivian? I'm sorry if I butchered that, but that's your shout out. Hey. Let me see. Princess Diana. Oh, look at the little teddy bears. Those are cute. Hey, girl. Let me see. What's Fredo? What's my birthstone? Oh, I'm a Gemini, so yeah. It's a couple of birthstones that when you look up, one sometimes it's a pearl, the other one is a what is it? I'm not even gonna butcher what it is. It's the purple stone. Okay, let me go back because I'm missing some comments. Okay. All right, COVID was no joke. Almost lost my mother. Yeah, it wasn't a joke. I lost my grandmother. I lost an uncle. I lost um, some cousins. It was terrible. I'm glad your mother, I'm glad she was able to fight through it. Okay, let me see. Can I say hi to Gabby? Hi, Gabby. And hi, Jean. All right. Maria, hello. Let me see. Girl, you're beautiful. Thank you, Screen Craze. I try my best. Let me see. The urge. Misconception of me. The urge. Are you in healthcare? Let me see. Uh, okay. So let's get back to okay, Jean. I think Jean, I gave you a shout out, but Gabby as well. Hello. All right. Irish. No, I'm not Catholic. Yeah, Emily, it's a lot of real nasty people in general. And you know what? It's nasty people in healthcare, on the internet, you know, everywhere around you. And a lot of people, they hide behind computers and they type up little rude remarks. I've seen a lot of them since my channel has been, hitting the algorithm. And you know what? It's like some people do it to like get you upset. And then some people just don't care and they just want to verbalize something. And it's like, okay, well, I'll acknowledge that I saw what you said and I may delete it, but thanks for taking the time to write on my channel. Let me see. Yeah, sorry to hear that, Alex. Thank you so much. Let me see. Sweaty Milk. Now that's a name for you. Sweaty Milk. Okay. Um, hey Brandon. Let's see. Is it Layla? Hi Layla. What do I eat to maintain my figure like that? I don't eat meat. So let me see, how old is my child? My youngest is 6. So for 7 years, I haven't eaten meat. For the first maybe 3 or 4 years, I was a vegan, and now I'm vegetarian because we kind of dabble a little bit in dairy, but I don't eat meat. So that's how I am. Catherine, hey, shout out to Catherine. Hopefully all these shout outs, y'all giving me some thumbs up. And if anybody have any questions or comments on, the misconception of nursing, let me know. Let me see. I love your shirt. Thank you. This is a whole jumpsuit, though. Are you a Christian? I am. Let me see. Ava, I don't know what happened to your message. It got retracted. Okay, Emily, you work in medical billing. The phone calls, oh my God, the phone calls, I'd rather be punching a bag than my doctor's office. So in my current position that I'm at, I have to call patients. And a lot of these patients are upset. They're upset because they want to come into the clinic, and the clinic is booked out for 2 months minimum. And people are in pain. They want their pain medication. They want injections. They want all of this different stuff. And the schedulers will say, oh, well, let me have the nurse to answer this question for you. If there's no opening, it's no way that I can open a spot for you, especially if you're new. If you're established, and I can see if they can squeeze you in, but patients be mad everywhere. Okay. Greatness is where I got COVID too. I think I was supposed to go to the hospital. Yes, I'm glad you survived too. And hopefully, I don't know if I finished answering your question, but I started getting all these comments. If you have another question for me, greatness is rare, let me know. But I do, to kind of piggyback on the shortage of nursing, with everybody retiring, schools are going to increase because the cost of living is increasing. And what you have to do is you have to find the best schools that will give the scholarships. You have to do some research, get some grants, get scholarships for nursing or whatever field you're trying to go into. Do that research so that when you're in school, you don't have a whole bunch of student loans. And then when you start working, some of those jobs will, or actually, if you're already working in healthcare, work at a hospital that does tuition reimbursement. And while you're working and you're getting your good grades, you send them a transcript of your good grades. They'll pay back your tuition. That's the best way to do it. How many people work with you? What kind of nursing do you do? I'm curious. Ava. Okay, so I've been travel nursing, but currently where I'm at now, I work in a pain clinic. I do what they call it case management, but I'm doing a few things because I'm calling patients. Our clinic has anywhere between 80 to 100 patients a day. So we have a couple of nursing assistants. It's a couple of nurses there. And I have, put it like this, it's about 40 plus of us, but not on one day. I have about 5 providers that I take care of, as well as there's another clinic that's attached to mine. So if she's out, then I'll look after hers. But it's a really busy clinic that I'm currently working at. Okay. Let me see. Hey, Ava. Let me see. It's a long way to go. Hi, guys. Larry. What's wrong, Larry? Why you say no? What made you want to do this job? So let me tell you, when you get into nursing, you interview, you ask, please ask all of your questions up front. Now, what happened with me was I was doing travel and I was doing oncology. So, if you have an oncology background, you know that if you want to get certified, you need to have so many years under your belt, and then you study for your test, and then you go get, I think it's ONC certified. I was working on that. So when I went over to this place that I'm at, because I don't say names, because who knows who watching my channel that work with me. They're not trying to, say that I'm bashing anybody, and I'm not. But the situation was trash the way I got into this current role. So I took a permanent position because I'm trying to do something in my future, and it won't allow me to travel. They need to see a consistent type of deal, so I have to be at a staff job for a certain amount of time. Now, after I get what I want, I may go back into traveling because I'm always looking. So, back to the story. So, I interviewed. I was supposed to be in oncology because this was going to expand my years under my belt so that I could be certified. And then I was going to cross train to be chemo certified. When I got to the position, they cut off they canceled a few positions. They were doing budget cuts. So instead of canceling the position, they just threw the people that were in the process of being hired into another area, another clinic, or another wherever, right? Which, this is the trash part. So I was informed about where I was going literally one day before going into that clinic. It was not oncology. It's pain. Pain and oncology specialties are similar but totally different. And it ruined my chance of being chemo certified, cross training, and all of that. And the terrible part is the big boss didn't come and talk to me until I was 2 months in to say, oh, I apologize. This happened for this happened for that. I had a letter signed on where I was going to be. The person that hired me actually quit before I started, and she moved to another state. I'm like, where is so and so? So whoever was in the process, they literally threw us in the worst clinic. But I'm making it do what it do. We getting congratulatory remarks. I'm bringing positivity in there. The doctors are opening up more because I have that travel background of going into trash, making things better. So that's where I'm currently at. That wasn't the role that I currently wanted, but I was thrown in there. So I'm trying to see if I still want to do what I'm doing currently now. It's not that hard of a job, but it's some people that's in that clinic that are, I'm not even going to say the right words. I'm just going to say there's something else. And it's draining to a certain degree. Okay. Alex, I have a question for you. Being in the medical field, is there a supplement you recommend for testosterone? I do not. I have not worked with, because my background is more ER, ICU, and then I was a supervisor in dialysis. So no, I don't have that information, but I will recommend Dr. Bobby Price. I follow his channel. He is a pharmacist, and he actually is the holistic route. So he'll give you pointers on what to eat. But Dr. Bobby Price, awesome. I think he has a lot of viewers. So if you haven't seen him, look him up. He's good, and I think he did a video on testosterone and what you can eat to boost it. Okay. That's good to know because I get all upset in the time. I took care of COVID patients. Ava, what do you currently do? Where are you working at? I'm interested if you're doing any fingerprints because that's my favorite thing. As a nurse, we'll do finger pricks if we got to get blood sugars or something like that. Most of the time, the nursing assistants will do it. But like if we have a patient and they're feeling dizzy and they're diabetic, of course the order has to be in. But yeah, we do finger pricks. What I do miss, since I'm in a setting, my background before I was a nurse was a phlebotomist. So I miss putting IVs in, drawing blood. But unfortunately, at my current clinic, they make everybody go down to the lab. So we're not even able to do that. Okay. Hey, Donna Rose, how are you? Can I do a day in a life with me? Um, I'm a little bit cautious of doing that in this facility because I don't have an office by myself. I literally share an office with three people. Well, it's three of us total. And out of the two people, they some nosy Nancy's, if you know what I mean. Okay, some nosy Karens. So I'm not necessarily gonna do that. And then I don't have an area that I could do a video like that. I think I've posted something when I was traveling in Ohio where I did a, you know, come to work with me. And, you know, this is a new channel. So my previous channel that I had a lot of different little things where I would record and I had an office myself and then I would get up and do certain things. But where I am now is probably a no-go because they nosy. Let me see. Um, Sorry. Well, I mean, this is a whole jumpsuit, and when I move my hands, it's gonna lift up. So sorry about that. I ain't trying to show nothing. To be honest, I'm not. It's just a jumpsuit, and I really like it. Okay. Thanks for having my back screen craze. And I actually, if you looked at that short where I was trying on outfits, this was one of the outfits. So okay. No, I do not have a pager. I'm doing good, Ava. I do not have a pager. I don't want to have a pager either. Um, I I'm not on call for anything, so I don't think. Well, I had a pager once when I was traveling the end of last year, but it was only like to do critical labs and stuff like that so that I could get those and reach out to the doctors to see what they needed to do for the oncology patients. But no, I don't have a pager. I just have a regular office phone, and usually the dynamic in my office, I try to kind of go out there and be with the patients over being in the office. Read it between the lines if you want to. That's all I'm gonna say. You say you like my sweater. It's a whole jumpsuit, but thank you. Um, Ayla, your cousin Sam is a nurse. Awesome. Okay. And my friend Serena, who works at my school, she's a nurse. Okay. What about scar tissue? What do you? I'm sorry, Sarah. Are you talking about drawing blood? Let me know a little bit more in depth when you mean what about scar tissue. How long does a RN or LVN certification take? Me. Do you think if I take this course in my 40s, it is, girl, it is not too late. Okay, so I've seen another person write something about, I'm in nursing school, I'm 38, I'm 36. I went to school with a young lady that was 50. She passed her boards in her 50s. I currently work with a nurse that's 60. She's only been a nurse for 5 years. So when people think that it's too late, it is not. I'm gonna drink some water because I'm running my mouth. I'm spilling. Don't judge me, yo. Okay, so all right, okay, so me. The RN, so what I did for me was for the RN, I went to a community college. So when I was in school, I had two small kids. I was a single mom, and I went to a community college so I could do those 2 years. I got my associate's degree. I immediately start looking. It's easy for you to get a job once you get, pass boards and you get your your associate's degree. They need nurses bad, okay? So pass boards and you can apply wherever, and you pretty much gonna take the job, get the job because they need you. For the LVN, or what we call in Michigan LPN, licensed practical nurse, that only takes a year. So, you can go to, again, you can go to a community college. And what I want to tell you guys, when you go into school for RN, LPN, and say you want to work for the government, make sure that your school is accredited. Because if it's not accredited and you get yourself all the way up to working, and you've had so many years experience and your school wasn't accredited, they won't even take you. They're really strict on getting into their just getting into their hospital with you not having an accredited school. Now, if you go to, say you go to a school, you get your associate's degree, you go back to get your bachelor's, and that school is accredited, you're totally fine because they're going to look at your most recent school. So just keep that in mind. Okay, let me see. So RN, if you take your associates, is 2 years. LVN is 1 year. If you go to a university, they're going to stretch it all the way out. But I would suggest, if you want to do it the cost-efficient route, unless you have a full ride scholarship, go to a community college and make sure, it's a brick and mortar, that it's accredited, and go get your money when you graduate and you pass boards. Okay, actually, I'm trying to find myself a job. Ava, what are you trying to find? Where are you trying to work at? Denise, my sister became an RN in her 40s. See, I'm telling you, in my class, I think there was quite a few that were in their 20s. You would still see a few sprinkle in that were a little seasoned, but we all got through. We all passed boards, and we all nurses. Okay. Eric, you taking a HESI exam Monday. Good luck. Good luck. I think for me, they made us take the TEAS test. And the TEAS test was so easy. It was ridiculous. I think you had to have, dang, what was the percentage? Maybe 70% on everything. And of course, it was so easy. I didn't even study for it. I just went in and took it just to see. And I passed with flying colors, but the HESI is a little bit harder. So hopefully you've been studying, because they have books to study or whatever. And I know you'll do fine, Eric. Keep me posted on that too. Let me see. My boss told me you can always fix regrets to some degree. It is never too late to follow a passion. Absolutely. It's never too late. Okay, how many hours do you work? I work 40 hours. I work in a clinic, so I work Monday through Friday, and I work 40 hours. No overtime. They're not paying me overtime, so I ain't doing it. My sweater should cover. Oh, look. I'm going to pull this all the way up for y'all, because it's a whole jumpsuit. It's a one piece. So it's not a sweater. It's just a whole, and it's long. So I'm kind of tall, and it's long. So I'm sorry. I pulled it up. Hopefully it stays up. Okay. Because I don't want to distract anything. I just want to be here for y'all and answer whatever questions. Let me see. Is passing boards hard or easy depending on how you were taught? So me. Passing boards can be hard, but you have to really pay attention to your studies. So when you are in nursing school is a whole nother beast. It's going to change your mindset from your regular, and you're going to think of patient care, not just textbook of this is what's the answer, or so and so is this. What's the answer to this word? Or what's the definition of this word? You'll never get that. You're going to get a patient comes in that's short of breath. His O2 sat is 82%. His pain level is 10 out of 10. He has a scratch on his leg, and he has blood on his shirt. a little bit of blood on his shirt. Which one will you assess first? It's going to be a question like that. So you want to assess all of it because you want the patient to, they're coming in because they need help. You want the patient to be pain-free. You want them to be able to breathe better because the O2 sat should be anywhere between 90 and 100. And if he's in the 80s, that's number one, oxygen. So you're going to have questions like that. But of course you want to get his pain score down. You want to clean up his scrapes. You want to see the little blood that's on his shirt, what's going on with that. But what's more important in that setting is oxygen because it's below the normal range. Okay. But if you really pay attention when you're studying and you have that mindset of, okay, this is the reason for this is the reason for that, you're going to know your pharmacology. It's a whole bunch of drugs that are in the same realm that have the same ending that's going to help you. So it can be easy, but remember to take your time. It is a time test, but you don't want to blow through it so quick that you're missing all these questions and then the computer cuts off. You want to take your time, answer the correct thing, because you're going to have some select all that applies, which is a headache because most of the stuff in there is going to be, it's going to look like it's correct, but it's not. So you're going to have to select whatever and rule out what's not important. And again, you'll get that in your studies. It sounds like it's a bit much right now, but as you're studying, the school is going to teach you how to pass the NCLEX. You just have to pay attention and take a deep breath, and don't tell nobody when you take your test because people will get on your nerves and you'll have anxiety and you'll fail if you don't keep that to yourself because people gonna bother you around that time. Not intentional, but they will. Okay. What is this? Baby snaps. What? Hey, she wanna be a glazed donut. What's a glazed donut? Maybe I shouldn't answer that. Anyway, do you guys do cold blue? So at the hospital that I work at, being that I'm in a clinic, we can call cold blues. We have a crash cart, but again, like I said, I'm ER background, so if something happened, I'm usually people with critical care, we run into the problem to see what's going on in a hospital setting because we can have patients that fall out in the hallway when they're trying to go home. Because it's a big hospital that has clinics, it has inpatient, it has patients that live there. It's a whole bunch. So yes, we do cold blues. Sometimes they even do mock cold blues in the hospital. So we have to be on top of it. Okay. Ada, thank you for having my back. Let me see. Any recommendations for those with test anxiety? So Emily. Yes, I just saw that pop up. Mock cold blue. Yes. So they have, people get upset when you call them dummies, but the mannequins that we do our CPR on, they'll have a full mannequin and they'll say cold blue in whatever hallway, second floor, third floor, whatever. So we go and when we see it, we're like, okay, so we're trying to practice on this mannequin to make sure that we're doing the correct thing. And then the instructor is going to be there too. So it's a mock cold blue. I've never worked anywhere that had them like this, but here. And no, I won't disclose where I work at. Test anxiety, Emily. Okay, so I'm more so one that likes holistic routes. I don't take any medications. I just, do a vitamin or so to keep my immune system together, maybe an elderberry gummy or something like that. So lavender is calming. The lavender scent, you have to, because I know you can't have earbuds in there, so you can't have any calming music when you're taking your test. But you have to pull out the calming aspect, wear lavender lotion, or they have lavender scents. You can, I think I saw someone with a lavender infused washcloth that you can warm up, and I don't know if you can bring that in for testing, but lavender is calming. That should help you, even if you drink lavender tea. But I know the topical, lotion, just putting lotion on, or studying maybe with lavender candles, stuff like that could probably help. Let me see. Wow, I'm getting excited about doing this now. This is awesome advice. Thanks. Gives me the confidence. It's Rachel. Hey, Rachel. I'm glad that I gave you the confidence, because I wish, and I hope I'm getting some likes, guys. I wish that when I was in nursing school, well, I wasn't really on YouTube like that. Yeah, back then I wasn't. But I wish that it was somebody that would kind of tell me, the truth about nursing. And thank you, Emily. And to kind of say, look, it's not going to always be rainbows and sunshine, because it's not. It's going to be some good days. It's going to be some bad days. But that's in any type of thing, any type of day while you're working. Now, I do want to get into this, because I always hear this misconception of nursing as, you in nursing for the money. How many people, okay, out of these 46 people, I want y'all to comment. Do you think that people get into nursing for the money? Comment below, yes or no. I need y'all to chime in while I drink this water. Do y'all think people get into nursing for the money? Yes or no? Come on, y'all. Don't be afraid. It's okay to say yes. It's okay to say no. Do you think people get into nursing for the money? Nope. Or, well, I hope the majority of people don't. Anybody else? Thanks, Emily, for your comment. Anybody else thinks that people are getting into nursing for the money? I know 40 of y'all are not that shy. Or 30 plus of y'all are not that shy to say yes or no. It is, I will not get offended. I'm totally giving y'all the opportunity. Cloud, is it Cloud Bills? It varies. Okay, that's a good one. That's a tough one, but I would say no. Denise. Anybody else? I appreciate y'all for giving me some feedback. I like interacting with people. I know we all can't get on this live together, but just seeing the comments, that's helpful. Okay, I think a part of it is for the money. Imagine not being well compensated in the demanding field. Okay, Eric, go ahead, take that Hesse so you can go on to school and you can get them coins. And the reason why I'm saying this is, when you're working a job, how about this? Let me see. Personally, I don't. I'm a CNA at a nursing home, but it seems the difference in those doing the money, their attitude, and the. Okay, so I think Rachel, right? That's Rachel. Me, I think. Yeah, Rachel. Okay, so I'm gonna get into. Okay, a new name popped up. I don't know how to pronounce that. Is it Kate Kemi? I'm sorry if I butchered that. I've been a CNA for a few months. Any advice, tips on applying for nursing school? Yes, I'm gonna give you that as soon as I answer this question. Cloudville, can you tell when they are in for the money? Because they usually avoid helping. Okay, so my opinion. Some nursing schools, you have to write an essay on why you want to become a nurse, right? Some of them. I don't know if it's all of them, or they just letting whoever can pay the money get in, or who had the grades, or who can pass the Hesse, or however it goes. For me, I was a phlebotomist. I already was in healthcare, but I wanted to help the patients more than just poking them with the needle and getting blood, right? If you worked in healthcare, you know that labs are essential. The doctor don't know what's going on without seeing the blood work. The nurses can help better to medicate the patient with doctor's orders because of the blood work. So, of course, phlebotomy is top tier because the lab can make so much money for the hospital itself. What I When I was in nursing school, because nursing school you can't really work full time like that unless you're single and you work maybe nights. Um, like I said, I had two kids, and my two older ones are pretty much grown now. My 17-year-old will be graduating high school on the 7th. So, and my oldest is in college already. I just got that baby that's on my profile pic. So starting all over, but it is what it is. Um, for me, I wanted to help people, but also I wanted a better quality of life for my children. That is the perfect way to say I wanted more money. So when people are in nursing for the money, it's true. Not one nurse is volunteering for her time to help a patient for free. We love on our patients. What we should. We love on our patients. We are a team with the doctor, with the respiratory therapist, with the CNAs, with the PCTs, with pharmacy, with housekeeping, with transport. We are a team. We work together. We all have our little roles and parts. But when you work a job, you got to get paid. So for me, phlebotomy wasn't enough for me to raise my two daughters. I knew eventually they were going to be older, they were going to need money put aside for college, stuff like that. And that's when traveling really helped me to put some coins up for them. I couldn't have done that if I didn't go into nursing and educated myself to be better. Now, you can, let me see. Let me go back. Personally don't. So you definitely can see a difference. Oh, let me go back. Think about real estate. What real estate agent is in it for free? When you sell a home and you have a high commission, especially those real estate shows that are on Netflix. I forgot the name of them, but I watch them because those houses are so beautiful. I love to look at them. I don't have a house like that, but they're so beautiful to watch, and their commissions be like 100,000, 500,000, a million. I'm like, goodness, you think they was getting into real estate just because they wanted to help people get a home, because they liked interior design, because they liked the way a house look on the block? No, they wanted that big commission so that they could live a better quality of life. If I'm wrong, let me know in the comments. Okay. Let me see. CNA for a few months. Any advice and tips? Okay, so tips on applying for nursing. You don't have to have a prerequisite of being in a nursing field. You can literally work at Best Buy. No shade, no shade at Best Buy, because I love them. They got money from me, from my stove I just bought. I got from Best Buy. But you literally can work at Best Buy and apply for nursing. It's just based on what their criteria is. So if they want you to take, like Eric, he's taking the HESI exam on Monday, tomorrow. You got that, Eric. You got it. They're going to want you to do some testing. You may have to do some type of prerequisite classes in order to apply for the nursing program. So you have to just reach out to the school that you're interested in, and then they'll tell you what you need in order to get in the program. Some programs have waiting lists. When I was in nursing school way back, not too far back, but way back, 10 years ago, there was waiting lists. And I went to a whole nother school because I didn't want to wait 2 to 3 years waiting for them to open up the nursing program for me. I went to a school, I took some classes, transferred my stuff from the one school to another one, and started the program within, let me see, was it within months to a year? So I wasn't playing. I was trying to get that for my children, because again, I was no longer, but I was a single mom with 2 girls. Okay. So definitely apply, but get the criteria of what's needed in order to get in the program. Okay, can you tell when they are in for the money? Because usually okay, so I would say sometimes you can tell when they're in for the money, sometimes you can't. It could be somebody that's pleasant, that's willing to help, that want to earn their keep. The lazy ones, Cloud, is the ones you look out for, and you don't know if they just lazy in general. They might have been a lazy person before they was even in nursing. Or they might just be burnt out because nursing does a toll to your body. So a lot of the seasoned nurses or nurses that's in between, because I don't call myself seasoned, I've only been a nurse for 8 years. We are not going to be at the bedside forever because it does a toll on your body. So, it's the reason right now that I'm in a clinic and I'm doing like case management for that clinic. I eventually do want to work myself up into being a nurse educator because I love to teach and share knowledge to people that want to be in nursing or, just want to go in that field or just have questions about what's the next step. I would love to get into that, and hopefully I can get into that pretty soon. Okay. Denise, when my sister became a nurse, as I said, in her 40s, she had 3 kids at home. Yeah, you got to do what you got to do. Because what's going to help you with those children? A better paying job. So when people say, oh, you in nursing for the money, why? What's their why? Are they in nursing to have a better life for their children? Are they in nursing to have a better life for themselves? Are they in nursing to have a better life for, because they want to be at a certain area? And nurses don't make all of the money. They really don't. They make a good amount compared to working at a McDonald's, but they don't make all of that money. You have to level yourself up and go back to school and get certain degrees and work the right job. If you're not working the right job, because I've worked with a nurse a couple of years ago when I was on a travel assignment. This travel assignment that I worked, I made $4,100 a week. Okay, I had coins for this travel assignment. And it was literally an hour away from home, so I could come home every day, which was perfect because my husband and my children were at home, and I was like, oh, I don't want to be away from them. So the nurse that I worked at, real cool. I actually talked her out of going somewhere else, and she has a work from home job that I encouraged her to get. She was working at this hospital. Again, this hospital paid me $4,100 a week, but their nurses was getting like $30 an hour, maybe 32. I'm trying to remember what she told me because this was in 2022. And she lived in my state, but she was close to Ohio. So she worked in Ohio because she was right at the border. And I'm like, girl, you got kids at home. It was a pay cut for her to work there. I said, go ahead and get an insurance job where you can work from home and be there with your kids. She lives in a nice home. Her husband worked for the post office, so they had some pretty good money. They had a whole bunch of land. I think they even had a pool and horses. They had that much land. I said, girl, what you worried about this little nickel and dime job for when you could work from home and you can get more money? You could at least get, I think, the area that she was trying to reach out to get the job for. I think they started off at like 40 plus. I'm like, girl, go get that job. Forget this place. And she did. Okay. Let me see. I think those are all fair assessments, to be honest. I look at my paycheck and go, I didn't get paid enough for this. Yeah. You definitely. And Emily, there are some medical assistants, because I think you said you're a medical assistant. I think there were some medical assistants or some CNAs that make $20 an hour, but they've been in the game for 20, 30 years, and they just don't want to go back to school. So, it's a possibility that you can get more, but if you want to go to school, please do. And keep me posted on that. Okay. Denise, you can't really compare reality to nursing. No, you cannot, because let me tell y'all, if y'all are in school right now for nursing or thinking about nursing, nursing school is going to give you in a perfect world setting. Not the truth. Not the truth at all. I keep splashing water all over me, y'all. I'm sorry. In a perfect world, but when you get to the job, it's like, this is where you truly learn nursing. You get the basics, you get, the textbook but hands-on experience is going to be everything. You do need nursing school because it's going to change the way that you think. But when you get into the hospital or wherever you decide to work, that's when you're going to actually start getting that knowledge that you need. Okay. You're welcome, Eric. That's right. Good luck, Eric. Where do I find the baby saving guy? Vinny. Okay, Vinny. If you look, I did 3 videos on him. He's an Egyptian neonatologist. He is awesome. I follow him on Facebook. So out of those 3 videos, I think 2 of them is at 9 million views. Click on the description. I will put the link. I put the link of his Facebook page that I follow on there. I think on Facebook he got about 2.3 million followers. That man is everything. You could tell he cares about what he does. And I know that it's probably hard when he doesn't get the baby back. And I don't think he shows those videos. He shows, just him resuscitating the baby or giving rescue breaths, and that color coming back into the body's and the baby's body is amazing. He does a good job. But yes, so I don't know I think somebody wrote his name in one of my comments and I forgot it that quick. But he's Egyptian, but his page is in the description of one of those 3 videos. I give him his credit. I just don't know how to pronounce his name. Okay. Thank you, MB. Let me see. I had a nursing school tell me I had to have an active CNA license to take the course, but they also preferred I was PRN so that I could commit to the course. But if that's my only full-time job, I have to know. Okay, so maybe that's just that place in particular, because unless something has changed in the last 10 years, you didn't have to pre-qualify with any healthcare background. Now, for them saying they prefer you to be PRN, that is true, because when you're working, if you're PRN, before you switch and do all of it to get in that school, you need to ask your employer, say, I'm working on getting into nursing school, so I need to be PRN so that I can pick up. Now, the downfall of PRN is you have no benefits. So I'm not sure if you're single, if you're married, but you may need benefits, so what I did was I worked part-time. So I still had my benefits, and I just worked after school. So when I was done with clinicals or done with class, I worked the afternoon. That's what I did for me. Hopefully that's helpful. Okay. My used-to-be sister-in-law was a nurse in the ER room for 30 years. She did that for them. Okay. Yeah, to be in the ER for 30 years, hopefully she was just a charge nurse, because after all of that time, you got to work your way up the ladder, because the ER is hard on your body. I actually went back to the ER that I originally started with when I was a new nurse and worked per diem, just picking up shifts because it's around the corner for me. But, at a point of after so many hours a day, I was over it. I was. And only because I wanted to get back into the ER, because I worked a clinic setting or a case management setting, and I wasn't hands-on with patients anymore, and I missed that. I missed putting in IVs. I missed, doing I always educate patients, but I missed that. So I did go into the ER and work per diem just so that I could get that touch again. But after so many hours, I was like, okay, I'm ready to go. And I never showed it to my patients, but I was just over being at the bedside. The way my scoliosis is set up, no, I didn't want to be at the bedside for 10 years plus. All right, thank you for the beautiful comment. Let me see. I do medical bill. Oh, Emily. Okay, I'm sorry. I thought you said medical assistant. Medical billing for a few years, but my mom has been a coder for 15 plus years. She only gets a few more dollars an hour than I do, which is insane. Wow. Okay. Eric, I didn't realize nursing is such a broad field. I would like to work as a travel nurse or in the ICU. I signed up for a 39-month program for BSN. Later on, earn. Oh, okay. So, Eric. Yeah, nursing is very broad. You can work anywhere. Like if you tired of the bedside, you can work for an insurance company and you can be sitting at home and you can be calling patients, and they actually, most insurance companies, they set up everything where you have a headset, their laptop, and you call in multiple patients checking on them. Easy. Um, but that's of course when you get more information under your belt. Some people, a lot of people during COVID, they went to the work from home because they didn't want to stop, they didn't want to miss out on their paycheck, and they didn't want to go back in the hospital, so they end up working from home. That's what they started doing, and it's okay. Okay, so Eric, when you work as a travel nurse or in the ICU, which I believe they allow you to look, because y'all keep talking about this, so let me get this together. Um, they'll allow you to start the ICU as a new grad. So when you graduate and you pass your boards, you can go immediately in ICU. When you're in when you're trying to get into CRNA school, make sure that that place is trauma one, is a trauma one facility, because some of the CRNA schools will not allow you to sign up if you work at a trauma 3 facility. So look into that when you're working at a hospital. It's easy to Google what hospital in my area is a level 1 trauma and then apply for them. It's simple. Oh, and then with travel nursing, you have to make sure that you have at least 2 years before you can travel, because a lot of people want you to have that nurse knowledge. They're not going to let you travel fresh out of school. That is a lose-lose situation. And if somebody allows you to do that, um, protect your license, because it's going to be gone pretty soon without that nurse knowledge. Okay. Vinny Boy, okay, thank you. You're welcome. Anybody else have comments, questions, concerns? Um, Let me know. I'm here. And I appreciate you guys for commenting and talking to me. You're welcome, Eric, for the information. I know you're going to do good. I know you are. Let me see. Denise. Dang, spell check. That was double, not dump. Okay, let me go back. What? My used to be sister-in-law was a nurse in the emergency room for 30 years. Maybe I double. She did. Oh, doubt. Oh, yeah. Yeah, if you in the ER for 30 years, um, you do it because you really enjoy that area, and hopefully, like, the ER didn't break her body down, because in the ER, you see multiple different things under one roof. You have psych patients, you are seeing traumas, depending on what trauma level your ER is. You seeing gunshot wounds, stab wounds, you seeing people coming in almost delivering their babies, you seeing respiratory distress, you seeing um sorry, you're seeing GI bleeds, you putting in NG tubes and OG tubes, and you doing all of this stuff. And that's why I love the ER, because you get everything under one roof as a novice nurse. Novice meaning less than 5 years. So once, and tip for y'all that's in nursing school that maybe you don't know where to start off with, start off and if you can stomach it, because when you're a nurse and you will have to stomach some stuff, okay? You literally gonna have to look through somebody's vomit and tell the doctor what color it is and what's in it when you work in the ER, because I've done it multiple times. um, when you're in when you're thinking about where to go, and even if it's for a year or two, go into critical care, ER or ICU, because say with that background you want to branch off and you want to go into another field. If you're trying to compete with another nurse that doesn't have a critical care background, you gonna get the job before they do, because they already know your mindset is get it. Let's hurry up and get it. Let's get everything together for the patient. Let's get it done. Not saying that med-surg and labor and delivery is not like that, because it might be. Those are just areas that I didn't work in. But if you're trying to move up the ladder, critical care background is going to help you when you're trying to move up the ladder 100% in nursing. Okay. Yes. What's the OF? I don't know what you mean, OF. Viv. Okay, Viv, that's your shout out, girl. Interesting. What's your OF? I don't know what. Oh my God! I do not have no OnlyFans, Alex. I'm a whole married woman. I'm not doing none of that. I don't need to do any of that either. Okay. Hi, I am from India. Hey, I don't know how to pronounce your name, but hey, from India. Let me see, Emily. How do you know if you're cut out for nursing? Like if you have a stomach or nerves? Okay. Thanks, Peaceful Ways. I didn't know what OF was. Clearly, I don't even do none of that stuff or look at it, so I didn't even know what it was. But I appreciate you for letting me know. Emily, so how do you know if you're cut out for it? So you have to think about if you have any aches or something that just gets under your skin or bothers you. Because with patient care, patients are going to come to you when they're sick. If they're pleasant and they'll be pleasant at some times, but if they're fine and dandy, you're not going to see them. They're going to come to the hospital when it's a problem. So you got to learn how to deal with people, have good customer service skills, patient care, be pleasant, do whatever you need to do for the patient. If it's something that bothers you, you got to kind of let me know if it's something that bothers you. And I can kind of tell you if something, like phobia of blood, something like that. So when you're in nursing, you're going to put medications through an IV. You're probably going to put an IV in, to be honest, or drawing blood with a butterfly needle or a straight needle. If you can't handle blood, nursing is not for you. It may be a patient that comes in that is sick and you give them a basin and they're vomiting, and it may be blood in the vomit. Or if throwing up bothers, that sound, it used to bother me until I had my children. That sound really used to get to me, but now I just kind of look away for a minute. I make sure that they're okay, and then it's over. So you got to let me know if you have any things that kind of get under your skin to where it'll stop you from nursing, because I'm not 100% Emily what those are. You said where I live in Michigan. Anybody else have any comments, questions, concerns? I appreciate you guys for staying with me this whole time. Anybody else? Let me see. If I was going to cover everything, let me see what was I going to mention something else? I mentioned the travel nurse. I mentioned her rate of pay. I mentioned her doing the TikTok. She probably was just trying to debrief from the situation. Can I talk more about CRNA? What do you want to know in particular about CRNA? Let me see. Mine is vomit. Yeah, Emily. Yeah, I couldn't hear the sound of it would get under I would just cringe, but everybody don't, when they vomit, they don't make a sound. Sometimes you just hear the liquid going into a bucket. So now they have like little vomit bags, so you don't have to pour it out and flush it. You just tie it up and throw it away. But in the vomit bags, the doctor may want to know what it looks like. So you have to examine it. Or if you want to hold it for them to look at it, you could do that too. But you get over it. It's not too bad. But it is what it is. Do you have human behavior or psych classes that teach you how to redirect or deal with irritated patients? Okay. So in nursing school, you do have a psych rotation. What I had to do, I took my psych class as well as my psych clinical. So for my psych clinical, I went to, I think it was what was it, a outpatient psych clinic. So they didn't live there, but the funny thing was, for these patients, the patients that were medicated, that were coherent and not, manic, they end up working there. So your staff is some of the psych patients, which was kind of cool for them because they could work. But if you're kind of like cautious of, let me watch my back because this is a psych patient and I don't know if they took their meds or whatever, then you could be on pins and needles. But it actually wasn't bad because they were just there. Like I said, it was a walk-in clinic, so they would come get their medications, get whatever education, and in the lobby it was like a TV for them to watch. They could go to the little store. It was like a little store in there where they can buy something to eat and drink. So it was pretty cool. But it's not like a hospital setting. The hospital setting for psych is different in every hospital. Let me see. Okay. So the requirements, since I'm not a CRNA, I'm just going based off of what I've heard, and I know people that want to venture into that. If you're going to school, immediately go for. I mean, if you're in school, finish school, pass boards, but when you're applying for the ICU, I think some people say you could do the ER, but it's the ICU. What you do is you go to a trauma one hospital. And when you're working in the trauma one hospital in the ICU, you need to work there at least 2 years before even applying for the CRNA. So, I mean, it's a quick Google search wherever you live at in particular. You can kind of Google that and say, okay, well, find me a CRNA school in whatever your state is. And then you can actually call and say, well, I'm interested in being a CRNA in the future. Can you tell me what's your criteria before I can apply? Do I need to be in a trauma one hospital working in the ICU for 2-3 years? You can ask some of that stuff. Sometimes they'll have a printout that you can find at the school or online. You just got to reach out to that particular school. But those are the key things I know about ICU, trauma one hospital, and being in the ICU for 2 years at least. Okay. Let's see. Rachel, oh man, I want to take that class too. I just deal with them over the phone. Okay. Um, is it Tuba Ray? You said it's night in India. Oh, okay. Hey Tuba, I said it. I'm sorry I was kind of going over the last question, but I got you, Tuba. Hey Tuba, shout out to Tuba in India. Okay. Anybody else have any questions, comments, concerns? I'm still here. As I sip this water, feel free to type in the chat. And I do, okay, so while y'all have any questions or want to type anything, I do want to talk about something. So, with nursing, nursing can help you to get into another income, like a whole nother stream of income. Because when you say you're working a department store job, right? You work in retail, you making maybe 15, 16, $17 an hour, depending on what state you're in. Because the cost of living is higher, they pay you more, right? So say, I'm sorry, if Thuba, I'm sorry, Thuba. Hopefully I said it right. Let me know if I said it right. Okay. But if you're working at a retail store, and say you're making under $20 an hour, just a regular floor associate, retail associate, and you're in nursing school, and you finish nursing school, and your first paycheck is way more than what you're used to, you excited about that, right? Some people will, because I think, what was this? For me, my first hourly wage as a nurse, a new nurse, was about $28 an hour. And it was, okay, good. And it was, I worked midnight. So back then, it was very hard to get on a day shift. You had to work nights to start off and then work your way into day shift. So night shift, I got shift diff. So I made about $30 an hour. And this is in Michigan. So it's not bad when you're a brand new nurse. And I think when I was a phlebotomist, I think the most I made was, let me see, $18 an hour. So I knew that 18 wasn't going to be enough for me to take care of my two children that were in elementary school. When they got older, I know they would need more. So, oh, my computer is about to die on me. And I don't think I can, let me see if I can try to plug this up. So when you're coming off from at least getting an extra, what, an extra $10, $12 an hour, that's a huge difference. A huge difference than actually getting, you know, this is almost doubling your salary. So when you are, you know, non-healthcare and you're getting into healthcare and you're almost doubling your salary, you can use your nursing salary to help you to venture off into something else. Like for me, what I did when I was travel nursing in the beginning, I made so much money, I saved it. And then I thought, what can I do with this so that I could get an extra set of income? Of course, YouTube is also good, but this, I got hacked. My last channel, I was getting money every month, but somebody hacked me. And I started this channel, which my old channel had about 24,000 subscribers, but this one is way more. So I end up being blessed by starting over and not giving up. So what I did was I put money towards my scrub line. So when most of the time when I'm wearing my scrubs in those videos, that's from my scrub line. So it's pettyscrubs.com. That is all my scrub line. So that's a whole nother set of income for me. And I still work full time. I get an income from that. And then my husband and I, we have a peer space. So if you haven't heard of peer space, it's we have actually a loft that content creators, people that want to take pictures, or podcasts, they all rent our space, and we charge them by the hour to rent the space. So now that's 3 sets of income from just from nursing. You see how you can venture that off? Hopefully this computer doesn't die because I haven't plugged it in. But you definitely can venture off and get multiple streams of income when you get a higher amount of money. Because a lot of these people say, oh, well, you can start this business with no money. Usually if you get something that's no money, it's going to take you a long time to get it, or you're going to have to really work hard to, you know, build an audience, to share it to them, to sell it to them. So definitely nursing can get you in a whole nother tax bracket, as well as get you in a whole nother area where you can have multiple streams of income. I couldn't do that as a phlebotomist. I couldn't. Let me see. Okay. All right. You saying bye-bye because you're going to sleep in India. Okay. Anybody else want to say anything before I end this chat? Because I think my plug is over there and I got my ring lights. So I don't want to go dark. Okay, good night for you, even though it's 3:53 here. All right, Denise, thanks for chiming in with me. All right, Emily, you welcome, you welcome. I appreciate you guys. I'm gonna try to see if I can consistently keep up these weekly lives. I did that on my previous channel. I really love the engagement with the audience because you'll see a lot of shorts from me, but I want to talk a little bit more about, a lot of these comments that I see. I'm like, okay, well, let me talk about those because it's a lot of misconceptions because people think that, nurses make all this money, and it's not always the case. Some of them make a good coin, but not all of them do. All right, non-healthcare professional wanting to open a home healthcare business. Any advice? Tiffany. Okay, Tiffany. Somebody I went to nursing school with, she has that same thing, a home healthcare business. And I think you just have to kind of like Google the information of what you need, because I know you need certain things in order to create a home healthcare business. It's several ones. Oh, thanks, Kelly. I'm glad you found it too. Hopefully, you guys have left me a few likes um, during this live. So, let me see. However, I do have experience in accounting and finance and healthcare. Okay. So, Tiffany, you kind of may have to reach out and do a quick, Google is everything. YouTube is a part of Google, Gmail, all of that. So, you may have to do a quick search on how to open up a home healthcare business. Are you running the business, or are you just going to hire people, Tiffany? I'm just trying to look to see what you say in the chat. But if you're running it, then that's one thing. But if you're just trying to be the person to fund it, then you need to reach out to because sometimes you might be able to let me see, Tiffany, maybe a local ship office could offer advice. Ships are local Medicare based info centers. Oh, okay. I would hire and find a doctor to partner with. Okay, so you need to actually, what you probably can do, because it's going to be hard just going in without the experience unless you know the right people. So some healthcare agencies, you probably, I don't know if they offer for you to what do you call it? Franchise. I don't know if they offer like franchises like that, but you may want to communicate with you could communicate with another agency. I'm not 100% sure if they'll be welcoming, unless you like partner with them or something like that. But you definitely got to do your research on what to do, and hopefully what Emily is saying about ships, the local Medicare based information, because home care, you definitely want to know some information from insurance. Medicare, Medicare is awesome. They're going to have all of the patients, and, you got to make sure that you are available for Medicare patients, that you can take their insurance or any other insurance. Because there's some home health care agencies that can't take certain insurances, and I would know this because of case management. When I'm sending patients over, they're like, oh, well, we can't accept Aetna for whatever reason. I don't know why, but some of them won't be able to accept everybody. So you probably got to do a little more research. I'm not the best person to give you that advice, but see if you can reach out to a home health agency to see if they can give you some tips, or kind of say, hey, I want to partner with you, or can I franchise your business? Can you give me the model that's needed in order for me to be successful with your company's name, type deal? You know what I'm saying? Hopefully that's helpful, Tiffany. Okay. I love these live chats and Q&A stuff. Yeah, I miss doing that because I used to do it all the time on my other channel before it was hacked. Let me see. A doc has to be your partner for sure. I will check out ships. Thanks, guys. Yep. And keep us posted, Tiffany, on how things go. Keep us posted for sure. Anybody else have any comments, questions, concerns before I end the chat? CMS is huge. It's a huge resource, great resource. They make it really nice, a layman. Yeah, CMS. Yeah, that's true. But I guess, Tiffany, you just got to know where to reach out to. So the first thing I definitely would do is maybe do a quick Google search. It may be somebody even on YouTube that has started a home health care agency, or, home health care business, that probably will do some type of mentorship or have a program that would kind of help you through the steps. Hopefully it's somebody out here, that would be beneficial, where you have somebody that can actually walk you through the process, and you just, pay them for their knowledge, because in nowadays it is possible on YouTube. Anybody else? I appreciate you guys for coming. And oh, wait a minute, I missed something. Kelly Ivy. I went through phlebotomy program. What are the downsides? So with phlebotomy, Kelly, the downsides of phlebotomy is, like, when I went to school for phlebotomy, it took me 9 months to get into the hospital that I wanted. I literally went to a college, but I did like continuing education courses. I think it was like 8 weeks. So I did Saturday classes while I worked full time, got my certification. I didn't get board certified, but I got my certificate. I applied for the hospital that was across the street from my house. It literally took 9 months. So I don't know if it's like that now, because phlebotomy, I think that was in '08 when I got into that hospital. So I'm sure things have changed, because that was so long ago. Um, but once you get in, I mean, what I would say is, do you want to draw blood, or do you want to be a specimen processor? Because you could do either one of those with phlebotomy. You don't necessarily have to be somebody that does venopunctures or finger pokes. You could actually be the person that gets the blood, spins it down, and takes the serum out and puts it into on slides, or whatever, for the pathologist to look at. Or you can just spin the blood down and take the serum out and put it in tubes and send it. You don't necessarily have to poke people. So let me know, Kelly, if you're still there, if that is something that you want to do, drawing blood, or if you want to um, be a specimen processor, because you could do both. Okay, you want to draw blood. Okay, so Kelly, what you want to do is, so do you want to only draw blood, or do you want to work in a hospital and, um, well, you can work in a hospital, draw blood. You can work as a nurse assistant. I don't know if all nurse assistants can draw blood though. Some of these hospitals are a little eh. So what I recommend is apply for a hospital in their lab to do phlebotomy. You can also go to these plasma centers, the places that allow you to donate blood, well, the patients to donate blood and get money. You can work there, like a ZL Plasma. I don't know what it is across the world, but that was one of the names that's around here. Um, you can also work at a doctor's office, because when I was a phlebotomist at a hospital, I actually had my own office, and patients would come in and see me, and I would draw their blood, and I would work Monday through Friday. It was an awesome job. I loved it there, but I was in nursing school, so I couldn't stay there. But we would get sales reps to feed us breakfast, lunch, and then, being that I was the youngest of everybody and I had small kids, they like, oh, Sheena, take this food home. So I took that food home. So it's perks to being in a clinic setting when they have sales reps. Let me see. There are also some local companies that are asking if I could do IVs. So definitely, because phlebotomy and IVs are in the same family, but they're not the same. Phlebotomy, you just putting the needle in and you getting blood. But the IV, you putting the needle in, you removing the needle, you keeping the plastic sheath in, and um, you are flushing to see if you're in a good vein, So you're doing that, and then you're taping it and you're securing it, and then you're doing a lock, a saline lock. But the IV is where the nurse is gonna, push meds through. So it's in the same family, but it's good for you to have phlebotomy experience before going into doing IVs, because it's two different things. Thank you. There are so many plasma centers here. Yes. So try going over with them. I think with plasma centers, their needles are way bigger than a lot of others. Also, well, I don't want to scare you away with big needles, but dialysis centers have huge needles. Sometimes you can work in dialysis because you're putting in the needles for the patient to get on the machine. So you can try that as well. But some dialysis centers want you to have an associate's degree in something. And some of them, they're like, we need to help as long as you have a certification with something and maybe some type of healthcare experience, they'll take you. So I would apply in every area that I can that involves venopunctures. Yeah, you're not going to be taught IVs in school. Even in nursing school, I'm going to tell you this. When I was in nursing school, they knew that I had a phlebotomy background because I was a phlebotomist for 8 years before getting into nursing school. So during that time frame, they had like a little dummy arm. So, see ya. Bye. Oh, my child going to work. So they had like a little dummy arm, and the nurse actually in sim lab, she was like, Sheena, would you like to teach the phlebotomy portion? I'm like, no, because number one, I ain't getting paid for this. Number two, I wasn't taught on a dummy arm. When I was in phlebotomy school, we drew blood on ourselves. I was able to draw blood on the instructor, so we drew blood on human veins, not just a perfectly round vein that stands up. Everybody's veins are not going to be like that. So they don't teach IVs in school the proper way. You learn it more so when you're out in the field. Hopefully that's helpful, Kelly Ivy. Emily, you said that ain't my job. What do you do, Emily? Oh, you medical billing. Okay. You said that ain't my job. You laughing at me. I got it. No, because I'm a broke nursing student, and she asked me if I want to teach that portion of the course. We're in sim lab. I'm learning from you. Why should I teach everybody how to draw blood? And I'm learning nursing. So, she didn't really show us. I just kind of was like, okay, maybe she don't draw blood herself. So, here's what it is. All right, guys. I think I'm going to wrap it up unless somebody sneak in a little last minute note, which is fine with me because I don't want my computer to die because I'm able to look at the chats on my computer and my phone is right here, so I can't turn around and look at the chats while on the phone. You have a good day. I appreciate that. All right, y'all. I'm going to do the countdown. Then I'm going to end it. 5, 4, 3, 2, 1. All right, y'all. Have a good one. Let's see.